Do you see me? Science and Advocacy, Postpartum Mothers, Birth Trauma, and Post-Traumatic Stress Disorder. I'm Abbas Shobeiri, Professor of Biomedical Engineering and Medical Education. This is an audio tour accompanying the exhibition. Do you see me? The exhibition takes the viewer through 7 stages of grief experienced by a mother who has experienced a traumatic birth. Grief as an emotional reaction experienced in response to a loss. Mothers with postpartum PTSD mourn the loss of functionalities that we all take for granted. Simple functions such as standing, walking, caring for self or the loved ones, or more complex functions such as voiding or engaging in intimacy with one's partner. Because childbirth is expected to be uneventful early on, and on bad days, the mother mostly experiences shock, denial, anger, depression, and detachment, and on good days, she may experience dialogue and bargaining, acceptance, and return to a meaningful life. The stages of grief are not linear, and individuals may experience them in different orders or not at all. Some people may not experience all the stages or move back and forth between them. In patients with pelvic floor trauma, a physical diagnosis is often difficult to make, and this cycle may continue for years or never come to a closure. The paintings are organized by one of the 7 stages of grief and further subcategorized into sub-stages. Each sub-stage is accompanied by a representative quote that conveys the concerns and feelings of women in this substage. Each painting aims to tell the story as if the woman in the painting is talking directly to the viewer. 4 paintings are not in the exhibition due to space constraints, but I will go through them so you can follow the complete storyline. These are stages 3D, 3E, 5C, and 7D. The events start with birth. This painting, called the turtle signs, chronicles that many events may cause pelvic floor trauma during childbirth. A stuck baby, operative vaginal delivery, and a difficult labor are a few of such causes. So what is a turtle sign? It is a rare and frightening moment for everyone involved. The baby's head comes out of the birth canal during the birth process, and then as the baby's body withdraws back into the mother's body, the shoulders become stuck behind the pubic bone, and the head becomes stuck. This presents an emergency for the baby and the mother. All the healthcare team members need to know exactly what to do to save the lives of both the baby and the mother. Every second counts. Certain maneuvers can dislodge the shoulders. Some may seem extreme, such as intentionally breaking the baby's clavicle bone. In severe cases, efforts are made to push the baby back into the uterus to perform an emergency cesarean section. Many women cannot recall the events and may relive every moment of this birth. The shock stage of grief cycle often described as the initial phase, is characterized by a sense of numbness, disbelief, and difficulty processing the reality of a loss, acting as a protective mechanism against the overwhelming pain. This painting, entitled Eden and Its Troubles, portrays the avoidance, which can manifest as a natural, albeit temporary, defense mechanism where individuals may avoid situations, reminders, or emotions related to the loss to cope with the overwhelming nature of the experience. The woman in this painting tells you, "I felt something was wrong. I went from doctor to doctor and was told what I was experiencing was normal. I felt ashamed for not being like the other mothers." This painting depicts the first birth. Adam and Eve are in the presence of their new miracle, their baby. But this is not a happy event for Eve. She feels as if something is wrong but cannot verbalize it. Adam is mesmerized at seeing his newborn and doesn't notice Eve's distress. The symptoms of postpartum depression have been undoubtedly present since the start of humanity, but have not been seriously addressed without stigma or shame. Confusion arises from overwhelming and often surreal nature of loss, leading to a sense of disorientation and difficulty processing the reality of the situation. This painting, entitled Dissonance, portrays the confusion that this woman is experiencing. She tells you, "My spirit animal is a fox. I thought of myself as a fox, intelligent and beautiful. I think of my husband and 2 children as my fox family. My trauma has made me shed my fox skin and be stuck in this bothersome human form. I struggle to heal, to join my family, but the choice is not mine." There are 2 energy fields contributing to 2 different realities. The fox woman is frozen in metamorphosis as her fox family awaits for her to go back to them. The wise crow is talking to her about her choices, but the choice to heal is really not hers. In this painting, entitled Free Fall, it portrays the fear that this woman is experiencing. Fear manifests as a sense of disbelief stemming from the overwhelming and sudden nature of the loss and trauma, leading to a feeling of being overwhelmed and uncertain about the future. She tells you, "I felt like I was in a free fall with my baby and could not reach her. No one could hear my cries for help." This painting recounts the everyday moment of catastrophic birth injuries that most women may remember. The anatomical right side of the mother's levator ani muscles, or the painting's left side, is injured, which starts the sequence of the psychological and physical trauma of PTSD in many women. This injury, often unidentified, will go on to create pelvic floor symptoms of prolapse, incontinence, and sexual dysfunction. This painting, entitled On the Edge, portrays the loneliness that this woman is experiencing. Loneliness manifests as a profound sense of isolation and emptiness, even when surrounded by others, stemming from the sudden and unexpected trauma and the difficulty in processing the situation. She tells you, "All I wanted to do was to sleep. My baby was next to me, but I felt like emotional storms separated us." A woman with pelvic floor trauma curls alone in the fetal position on clouds of emotional tornadoes that separate her from her baby and her partner. She is feeling an overwhelming feeling of isolation. She thinks that she does not matter and is not understood. She feels disconnected and cannot express her feelings. In the denial stage of grief, a person experiences shock and disbelief, often refusing to accept the reality of a loss, and may exhibit emotional numbness, confusion, or avoidance as a way to cope with the immediate pain. This painting, entitled "The Winds of Change," portrays the numbness that this woman is experiencing. Numbness refers to a state of emotional detachment or a temporary inability to feel or process the pain of a loss, serving as a protective mechanism to cope with the overwhelming emotions. She says, "I felt it come, engulf me and my baby. It was like a quiet storm, or an envious ghost that came to cover my eyes and cloud my mind." A new mother is wrapped in a tornado of uncertainty which makes her numb to the world around her. She shields herself and her baby from the full impact of grief, allowing herself to function and navigate the immediate aftermath of trauma. This painting, entitled "It Is Not Your Fault," portrays the blame that this woman is experiencing. Blame often manifests as a refusal to accept the reality of a loss, leading to the individual seeking to assign responsibility for the situation to others, to themselves, or even to the situation itself, rather than acknowledging the loss from trauma for what it is. She states, "I was not like this before I had my baby. I was confused. I could barely keep myself upright, never mind caring for a newborn. The mother is crouching away from her baby. There are hands that hold the baby towards her. A partner or a loved one offers the infant to the mother, yet she is separated from her baby by a distant tornado. On the upper right side, there is a faint light of hope." The third stage of grief is anger. Anger involves intense emotions like frustration, resentment, and a sense of injustice, which can manifest as irritability, outburst, or even self-harm. This painting, entitled "Maintaining Balance," demonstrates the frustration and helplessness, which are common and often manifesting as anger directed towards oneself, others, or even the situation itself. While happiness is unlikely to be present due to the overwhelming nature of the loss and the emotions associated with it. She states, "I felt instantly off balance. I was happy, exhausted, frustrated, and energetic. I looked for that sweet spot that brought my baby and me together, while constantly feeling the tug of dark and the life forces. Thankfully, I felt the constant call of my husband and my support. A woman struggles to orient herself to the new situation after birth. The happy infant with her umbilical cord attached is in a free fall, oblivious to the danger of falling. The mother is neither sad nor happy. She is grunting to maintain balance. She has a determined look as the forces tug on her. This is not a challenge that she is willing to lose. This painting, entitled Calm Amid Storms, portrays the anxiety that this woman is experiencing. Anxiety during the anger stage can manifest as heightened worry, nervousness, or even panic attacks, often stemming from the intense emotions and feelings of loss or injustice. She states, "People look at me as this superwoman who can do everything as I stand and care for my family. They don't see the electrical storms of pain, uncertainty, and disappointment with myself that surrounds me." With serenity on her face, the mother focuses entirely on her baby. Outside, storms are brewing. She ignores the internal pain from her pelvis to stand resolute in the face of uncertainties and take care of her family. This painting, entitled The Silver Moon in the Eye of the Storm, portrays the irritation that this woman is experiencing. Irritability refers to a heightened state of becoming annoyed, frustrated, or impatient, often manifesting as snapping at others, becoming short-tempered, or reacting negatively to minor inconveniences. She says, "The most beautiful moment I have waited for all my life comes with no silver lining, but a silver light that clouds my vision. Every touch, sound, or smell is irritating." The painting shows a breastfeeding mother with distress showing on her face as she struggles to breastfeed her newborn. She holds her baby's hand and faces away, not to show her grief as the life rages around her. This painting, entitled The Flight of Hope, is not shown, but it portrays the embarrassment that a woman experiences. Embarrassment can arise from feeling that the victim's anger is inappropriate, excessive, or that she is behaving in ways she doesn't recognize, potentially leading to shame or guilt. She's saying, "I try hard to be strong, but how can you pretend when you're hurt and embarrassed? All hope is gone." A crouching mother holds her baby. She has fallen, but is not defeated. She looks at us to let us know that the fight will continue. The butterfly representing her hope is within her reach. She may have let the butterfly go or is inviting a landing. This painting, entitled Holding Vigil, is not shown. It portrays shame. Shame can arise from feeling angry, which may be seen as an unacceptable or the wrong emotion, leading to self-blame or a sense of perceiving self as being a bad person. She states, lying like an injured animal, I curled up and cried for weeks. My head was hurting from crying. I could see through the haze. I could slowly see them. Superwomen need rest too. A postpartum mother is in the fetal position, trying to regain her energy on an altar with a background of burning candles to keep hope alive. The mother is painted in blue, but her skin is breaking with the light of hope. Her hair creates a river of blue. The waiting partner and the baby hold a candlelight vigil for her recovery. The fourth stage of the grief cycle is the depression and detachment. Individuals may experience profound sadness, hopelessness, and a sense of detachment from their emotions, potentially leading to withdrawal from social activities and difficulty with daily routines. This painting, entitled Breaking My Bubble, portrays the overwhelmed substage of grief. In this stage, mothers often experience intense emotional pain, including feelings of sorrow, numbness, or detachment, which can significantly impact their ability to cope with daily life. She states, I felt so overwhelmed. This little thing I had labored for seemed like the biggest weight hovering over me. A mother is lying in a fetal position to keep to herself and to shut out the world. She's painted in green to portray the emotional nausea she's experiencing. To her, the tiny baby is like a giant who breaks through her bubble to intrude in her safe space. This painting, entitled All is Lost, portrays the lack of energy that this woman is experiencing. During this stage, the mother may experience profound fatigue, a sense of hopelessness, and a detachment from usual activities and relationships, including her partner and the newborn. She says, I felt so alone, as if we were in a field of fire that was encroaching on us, but I could not save my baby or me. This mother represents many emotions. She's exhausted but keeps close to her baby. She's barely holding herself up. Their skins are breaking up into pieces because of extreme circumstances. A fire tornado that hides the father's eyes and face has risen behind the mother. Her world is burning down and crumbling, and the most she can do now is to lie next to her baby to shield him from the encroaching fire. This painting, entitled Shipwrecked, portrays the helplessness that this woman experiences. During the helplessness stage of grief, a new mother may experience a sense of being unsupported or not understood, leading to disorientation and a struggle to find meaning and purpose. She says, I felt like a dead fish flopping on the sand after a shipwreck, gasping for air. No one paid any attention to me. In the painting, there is a shipwreck in the center. The mother's face is like a dead fish sunken in the sand on the bottom left side. Her colors are muted and gray. The infant to the right, in comparison, is pink and healthy. The feathered and torn sail on the boat represents the mother's pelvic floor muscles. The baby's umbilical cord is made from the intertwined rays of her mother's energy that go through the mother's pelvic floor muscles to reach her. The other rays of energy coming from the family and friends contribute to the baby's umbilical cord from outside the mother. The mother, meanwhile, lies there with no safety cord attached to her, not receiving the badly needed support. In the fifth stage of grief, called dialogue and bargaining, a new mother with PTSD may attempt to negotiate with themselves, others, or a higher power to undo a loss or regain control, often expressing what-if statements and making deals in hope of a different outcome. This painting, entitled The Temple of Misery, portrays as these women are trying to reach out to others. The painting shows how these women are seeking support from loved ones, joining support groups, or engaging in therapy to process feelings and find comfort, ultimately allowing individuals to begin living again. The woman in this painting says, "Is there anyone else who feels like this? There is no one to talk to. I feel so alone. I feel like such a bad mother." In the background of the painting stands an ultrasound image of pelvic floor injury in black and white. You can see a gap on the left side of the image where the muscles have been lost. In the foreground, there is a community of women of every color in mourning. Where there is a void in the ultrasound picture, it shows the loss of women, as these women have been lost to suicides from depression and trauma. This painting, entitled The Sanctuary, portrays the desire to tell one's story. The desire to tell one's story stage of grief involves a strong urge to share the experience of trauma and the search for meaning and understanding, often through recounting the events and feelings surrounding the loss. This woman states, "My new self constantly mourns the loss of my former self and the functionalities that I took for granted." Sitting in the sanctuary is the memories of his former self in peace and contentment. Out the door frame is the new self, isolated, battling the approaching storms. This painting, entitled In the Forest of Her Dreams, portrays a woman as she struggles to find meaning. The struggle to find meaning stage involves searching for understanding and imagining what-if scenarios. The new mothers with PTSD may intensely try to make sense of the loss seeking answers to why it happened and if they could have done anything differently to prevent it. This woman says, I kept running the events through my head. What could I have done differently? Why didn't they tell me this could happen? Why did my doctor dismiss me as the only one with this problem? Why did I spend months trying to find my pelvic floor therapist, my psychotherapist, my path? It took me a year just to find you, and I'm the most aware and educated woman. It should not be like this. This painting demonstrates a woman as she is holding her baby, holding her head, trying to reconstruct the events in the forest of her memory. In the forest, you can see pelvic floor muscles and faces showing through. That could be doctors and nurses. But she cannot recollect the events. She's sitting on her hospital bed, thinking and thinking. Flashbacks, the best known symptoms of PTSD, relate to specific moments of birth during which the mother felt particularly vulnerable or scared. These moments could be when a person screams for help or looks at assistants' faces, smells, sounds, and sights in the room. Nightmares are the replay of trauma-induced anxiety. The flashbacks can induce physical responses such as increased heartbeats, sweating, or nausea. The next stage is acceptance. The mother acknowledges and comes to terms with the loss, finding a way to live and move forward rather than struggling against it. She might still feel sorrow, but she has accepted the reality of the loss and is focusing on celebrating life and making plans for the future. This painting, entitled Seeking, shows a woman as she is exploring options. In the exploring options stage of the grief cycle, the mother with PTSD starts to consider new possibilities, make plans, and actively move forward in her life. To do this, she requires a firm diagnosis of the physical trauma. Only then she can acknowledge the trauma and the loss of function and adapt to her new reality. She states, I have to take a step forward, overcome my fears, and discover what I'm capable of. The painting shows a woman with her baby as she stands at the edge of a frozen landscape. There is no other path to reach the aurora borealis on the other side, but to go through her innermost fears. Mothers with PTSD explore options as they seek ways to cope with and make peace with their trauma and their loss. This painting, entitled Rising Out of Depression, demonstrates a new plan in place, which involves exploring different options, embracing the new reality, and moving forward, and in this case upward, with a sense of hope and resilience. She states, I felt myself lifting each day very slowly rising from a very dark underworld that no human should ever visit. The voice of my child, my family, and the universe called me back towards the light. In this painting, the woman is suspended without resistance between the light and the darkness. The hope and support will pull her up towards the light. She has accepted the finality of the loss and integrated it into her life. The final stage of the grief cycle is returning to a meaningful life. It involves finding a new sense of purpose and joy after trauma and loss, allowing for future plans and a renewed focus on living life forward. This painting, entitled Resurrection, portrays the empowerment. Empowerment means that the new mother with PTSD begins to feel a renewed sense of strength and control, finding ways to move forward and integrate the loss into her life, often with a renewed sense of hope, strength, and purpose. She states, "You lose all your powers and are cast out. There is no hope and no choice but to fall to the bottom. After you have lost it all, there is nothing but hope, and the only way out of the darkness is up." This painting, painted in a manner of an angel cast out of heaven and lost her wings, the new self will learn to exist and overcome the new realities. This painting, entitled Never Let Me Go, portrays the emotional security that women may experience after childbirth. Emotional security is the feeling of safety, confidence, and freedom from apprehension, often stemming from a healthy interpersonal relationship and attachment styles. She states, "You're close enough that when your heart beats, I live. When you smile, it is my lips that curl up. When you touch my face, it is my hand that I feel. And when you sleep, they're my eyes that close." A mother and child find security in each other's presence. Emotional security is the state of feeling safe, secure, and protected in one's emotional environment. It is about having a sense of stability and trust in relationships and oneself. This painting, entitled The Goddess, portrays the self-esteem that a mother may experience. Self-esteem is a new mother's energy in understanding her strengths and accomplishments. She focuses on areas where she can contribute and make a difference. She challenges negative thoughts and replaces them with more realistic and positive ones. She acknowledges and celebrates small successes to build confidence and further her sense of accomplishments. She states, "I'm strong, I'm unique, I'm invincible, I have overcome." This mixed media panel is set on a background of gold, silver, and platinum. Her halo is made of obstetric forceps, and the sun rising behind her heralds a new beginning. Forceps are used in this panel because forceps, which are a known risk factor for pelvic floor trauma, are employed only in emergencies when the mother and infant's lives are in danger. Nowadays, there are better alternatives to forceps. I have always been impressed by the new mother's pose and resilience. Just because a goddess is resolute and resilient, it does not mean she is not suffering. The goddess is a portrait of the strength of the mothers in the face of overwhelming adversities. This woman, at this moment in time, feels kind, positive, and encouraging to herself, forgives herself, and has learned and adapted from her experiences. This painting, entitled The Moment of Enlightenment, portrays the stage of meaning. Finding meaning in the setting of postpartum post-traumatic stress disorder is finding a way to honor the trauma and the loss and who the woman was, and integrate that legacy into the new self, transforming grief, negative energy into a positive and lasting direction and focus. This woman states, it's an absolute feeling of contentment when your child feels secure in your presence and you feel secure in this world. You belong to each other and possess a knowledge that is unique to you. This panel incorporates large pieces of metal and other elements. The use of gold background accentuates the mother's status. The mother, painted in the manner of a lying Buddha, calmly wakes up as the first light heats her face and the mountains. She is lying on a bed of patina copper. The baby has woken up and is helping herself to breakfast. This is the moment of gaining the knowledge that true happiness is possible in this new family structure. By understanding the emotions of women with postpartum PTSD and retelling their stories, we open their psychological wounds and help them heal. This storytelling familiarizes the public with the problem of postpartum PTSD and allows a safe space for new mothers to voice their innermost fears and concerns without being judged, blamed, or shamed. Thank you for accompanying me on this emotionally difficult journey of compassion and understanding. Please feel free to support this movement on social media by following me at Shobeiri Art. Thank you.